Good morning to one and all. Today's topic is metabolism of aromatic amino acids. Phenylalanine, tyrosine, and tryptophan are the aromatic amino acids. Phenylalanine and tryptophan are nutritionally essential amino acids. But tyrosine is not, as it can be synthesized from phenylalanine. Catabolism of phenylalanine and tyrosine. Phenylalanine metabolism is initiated by its oxidation to tyrosine, which then undergoes oxidative degradations. This pathway is the catabolic pathway for phenylalanine and tyrosine. We know that phenylalanine is an essential amino acid which are taken through diet, and tyrosine is synthesized from phenylalanine. This first step is important for the conversion, that is phenylalanine essential amino acid to non-essential amino acids. Here, phenylalanine is converted to tyrosine in the presence of the enzyme phenylalanine hydroxylase. This enzyme requires a tetrahydrobiopterin as a cofactor, and this cofactor is oxidized to dihydrobiopterin. During this reaction, this dihydrobiopterin produced is again reduced back to tetrahydrobiopterin by dihydrobiopterin reductase enzyme. Here NADPH is reduced to NADP plus. In the second step, transamination of tyrosine with alpha ketoglutarate to para-hydroxyphenyl pyruvate. This is catalyzed by the tyrosine transaminase enzyme. In the third step, para-hydroxyphenyl pyruvate then reacts with oxygen to form homogentisate. This reaction is catalyzed by para-hydroxyphenyl pyruvate hydroxylase enzyme. This enzyme is otherwise called as dioxygenase because both atoms of oxygen are incorporated into the products, that is homogentisate. In this fourth step, homogentisate is then cleaved by oxygen to yield 4-malonyl acetoacetate. This reaction is catalyzed by homogentisate oxidase. 4-malonyl acetoacetate is then isomerized to form fumaryl acetoacetate by an enzyme malonyl acetoacetate isomerase that uses glutathione as a cofactor. Fumaryl acetoacetate is then cleaved into fumarate and acetoacetate by the enzyme fumaryl acetoacetate hydroxylase. It's an that is a fumarate is a glucogenic intermediate and acetoacetate is a ketogenic intermediate. Phenylalanine and tyrosine are therefore both glucogenic and ketogenic amino acid. Next, metabolic disorders of phenylalanine and tyrosine. Phenylketonuria. The first metabolic disorder of phenylalanine is phenylketonuria. This causes due to the deficiency of the enzyme phenylalanine hydroxylase. Due to the deficiency of the phenylalanine hydroxylase, the phenylalanine is not converted to tyrosine. They are accumulated. The phenylalanine is accumulated. It's an inborn error of phenylalanine metabolism associated with the inability to convert phenylalanine to tyrosine. Why there is an inability? Because of this deficiency or absence of phenylalanine hydroxylase enzyme. The phenylketonuria is inherited in an autosomal recessive disorders. The incidence of phenylketonuria is about 1 in 20,000 newborns. In phenylketonuria, there is an accumulation of phenylalanine in tissues and blood and results in its increased excretion in urine. Phenylketonuric patients cannot convert phenylalanine to tyrosine by normal pathway. So some minor pathways of phenylalanine becomes prominent phenylketonurics and accumulation of toxic metabolites of phenylalanine, such as phenylpyruvate, phenylactate, phenylacetate, and phenylacetylglutamine. The disease acquired its name phenylketonuria from the higher level of keto acid phenylpyruvate in the urine. Almost all untreated phenylketonurics are severely mentally retarded patients. Untreated phenylketonuria is life-threatening. Half are dead by age 20 and half are then 3/4 are by 30. This one is the alternative pathway of phenylalanine catabolism, phenylketonuria. We know that phenylalanine, that accumulated phenylalanine is converted to phenylpyruvate by the transamination reaction. Then phenylpyruvate is converted to phenylacetate and lactate, phenylacetylglutamate. These are the products which are synthesized by the accumulation of phenylalanine from the minor pathway. Now, coming to the classification of phenylketonuria, there are three types of phenylketonuria with their defects. Classic phenylketonuria or hyperphenylalanemia type 1. This is due to the defect in phenylalanine hydroxylase enzyme. And second type is atypical phenylketonuria or hyperphenylalanemia type 2 and type 3. This is due to defect in dihydrobiopterin reductase enzyme. Then hyperphenylalanemia type 4 and 5. This is due to the defect in dihydrobiopterin synthesis. Now coming to the characteristics of phenylketonuria. Phenyl acetate, which comes from the minor pathway, gives a urine a mousy odor. Some of the neurological symptoms, that is mental retardation, failure to walk and failure to talk, trauma and failure to grow. These are the neurological symptoms caused by phenylketonuria. Hypopigmentation, lighter skin color, fair color and blue eyes, it's all due to the deficiency of melanin pigment. Due to the deficiency of melanin pigment means that tyrosine is not synthesized. Again, tyrosine is deposited. The proper melanin pigments are not synthesized. Hydroxylation of tyrosine by tyrosinase is the first step in the formation of melanin that is competitively inhibited by high levels of phenylalanine in phenylketonuria. Diagnostic test for phenylketonuria. The urine of newborn was assayed by the addition of ferric chloride, which gives olive color due to the presence of phenylpyruvate. The main test, screening test, is phenylalanine in blood is assayed by using Guthrie's test. The gene for human phenylalanine hydroxylase has been cloned, so prenatal diagnosis of phenylketonuria is possible with the DNA probes. That's all about the phenylketonuria. Next, tyrosinemia. There are three types of tyrosinemia. Tyrosinemia type 1, otherwise called as tyrosinosis or hepatorenal tyrosinemia. Tyrosinemia type 2, Richner-Hornhart syndrome. And the third type is neonatal tyrosinemia. Tyrosinemia type 1 is also called as tyrosinosis or hepatorenal tyrosinemia. It is caused due to the deficiency of fumarate acetoacetate hydroxylase. The classification of tyrosinemia type 1 is acute and chronic tyrosinosis. Clinical features of tyrosinemia type 1. In acute tyrosinosis, the infant exhibits diarrhea, vomiting, cabbage-like odor, acute liver failure, which causes death. In chronic tyrosinosis, later life, it develops liver failure. Death occurs by age 10. Tyrosinemia type 2, otherwise called as Richner-Hornhart syndrome. Tyrosinemia type 2 is caused by genetic deficiency of hepatic enzyme tyrosine aminotransferase, otherwise called as tyrosine transaminase. Neonatal tyrosinemia, it is caused by the absence of the enzyme para-hydroxyphenylpyruvate hydroxylase. In neonatal tyrosinemia, serum tyrosine levels are high in premature infants, resulting from an immature liver and its limited ability to synthesize enzyme para-hydroxyphenylpyruvate hydroxylase. Clinical features of type 2 tyrosinemia. Accumulation of tyrosine produces lesions in eye and skin. Accumulation of tyrosine causes mild to moderate mental retardations. In neonatal tyrosinemia, these are the following clinical features. As the liver matures, the accumulated tyrosine is metabolized and serum levels decrease to adult level within 6 to 8 weeks of age. It's a benign condition which responds to well in ascorbic acid. The third inborn errors of metabolism are alkaptonuria. This inherited metabolic disorder is due to defect in enzyme homogentisate oxidase that catalyzes oxidation of homogentisate. Here is a homogentisase oxidized to benzoquinone acetate. This benzoquinone acetate, further polymerization, they form a black-colored alkapton bodies, which can bind with this connective tissues in later period that causes ochronosis. As a result, the homogenticate accumulates in blood and body tissues and is excreted in large amounts in urine. In the presence of oxygen, homogenticate in urine undergoes spontaneous oxidation in the environment that causes the black-colored urine. Clinical features of this alkaptonuria. It's a harmless condition. Later in life, deposition of dark-colored alkapton pigments in connective tissues and bones results in black pigmentation of the sclera, eye, ear, nose, cheeks, that is called as ochronosis. This leads to tissue damage and may develop joint pain, arthritis, and backache. The last inborn errors of metabolism of phenylalanine tyrosine is albinism. It is an inborn error of tyrosine catabolism. It is due to inherited deficiency of the enzyme tyrosinase. The inherited deficiency of tyrosinase impairs the synthesis of melanin from thyroid. Melanin or dark pigment of skin, hair, iris, and retinal epithelial cells. Melanin protects the body from harmful radiations of sunlight. Here is the pathway. Here, tyrosine is converted to DOPA, DOPA to dopaquinone and melanin. If there is a deficiency or absence of this tyrosinase enzyme, what happens that the tyrosine is accumulated, they are not converted to melanin, so that melanin production is decreased. So these are the clinical features of albinism. Hypopigmentations, because of that reduced level of melanin or no pigmentation, absence of melanin in the hair, eyes, skin, and leads to the white hair and skin. Albinos are highly sensitive to sunlight. Thus, who have that reduced level of melanin are called as albinos. They are very highly sensitive to sunlight and can lead to skin cancer. The lack of melanin pigment in eyes is responsible for photophobia and nystagmus. Next topic is biologically important compounds derived from tyrosine. Tyrosine serves as a precursor for the following several biologically important compounds, that is catecholamines, melanin pigments, thyroxine. Catecholamines are dopamine, norepinephrine, epinephrine. We know that norepinephrine and epinephrine are otherwise called as noradrenaline and adrenaline, which is a fight or flight hormone. Here, tyrosine to dopa, dopa to catecholamine conversions occurs, which are neurotransmitters. The same way tyrosine is converted to dopa, dopaquinone, and melanin pigments, what we discussed later in this albinism. Here, tyrosine to thyroxine, that is T3, T4 formations. Biosynthesis of catecholamines, Parkinson disease. In Parkinson disease, dopamine levels in the central nervous system are decreased because of the deficiency of cells that produce dopamine. This tyrosine to formation of epinephrine and norepinephrine. Biosynthesis of melanin pigment. Melanin is a pigment. Melanin occurs only in the pigment producing the cells called melanocytes. So here the tyrosine is not converted to melanin because of the absence of this tyrosinase enzyme, which causes albinism. So that reduces the formation of melanin in melanocytes. Biosynthesis of thyroxine and triiodothyroxine. The hormones thyroxine and triiodothyroxines are formed in the follicle cells of the thyroid gland by iodination of tyrosine residues of protein thyroglobulin. Monoiodo and diiodotyrosine residues are first formed and then react to form T3 and T4. Thank you.